Hello and welcome. Today, we're diving into something that's literally just beneath the surface, your skin. We're going to talk about dermatomes, which are basically your body's own secret invisible map.
So let me ask you this. Picture someone has a really bad accident, and a doctor needs to know, like right now, if there's a spinal cord injury. How can they possibly figure that out, sometimes with nothing more than a piece of cotton or a tiny pin? Well, the answer is pretty incredible.
That's right. They do it by reading a map that's laid out across your entire body, one that you can't see, but one that tells a super detailed story about what's going on inside your nervous system.
All right, so what is this map? Let's start by digging into this really amazing connection between your skin and your spine.
Okay, so think of it like this. Every single patch of skin on your body has a direct line, like a dedicated wire, that connects it to one specific nerve root popping out of your spinal cord. Now, this wiring is anything but random. It creates this highly organized system that doctors can use to diagnose all sorts of things. Now that we know this incredible connection exists, let's get a little more precise. What exactly is a dermatome?
And here we go. The textbook definition is actually pretty simple, but really powerful. A dermatome is just a strip of skin that's supplied or innervated by a single spinal nerve. It's like a territory on your skin that belongs to one and only one nerve from your spine. So what does that really mean? Well, its role in medicine is huge. Each dermatome is kind of like a neurological zip code. If a certain zip code on your skin isn't feeling things the way it should, a doctor knows exactly which spinal nerve to look at. This is how they can pinpoint spinal cord damage. It's also, by the way, why a virus like shingles causes a rash in a very specific stripe. It's just reactivating along a single dermatome's path.
This is all just amazing, right? But where did this map even come from? Well, it turns out it's one of the very first blueprints that gets drawn up when we're just beginning to develop.
So you have to go way, way back. This whole map gets laid down incredibly early. Around day 20 of development, tissue right next to what will become the spinal cord starts organizing itself into 31 pairs of segments. These are called somites. Then, each of those somites splits up, and one part, the dermatome part, migrates out to become the deep layer of your skin, forever linking that specific patch of skin to its own spinal nerve. And then, as your little arms and legs started to grow and stretch out, this segmented skin map just got pulled right along for the ride. And that's exactly why the dermatome map on our limbs looks like these long, kind of spiraling strips. It's that original, simple pattern, just stretched out over time.
Now, you'd think a map is a map, right? But in medicine, things can get a little more complicated. There are actually two main dermatome maps that doctors and clinicians use. So on one side, you have the Keegan and Garrett map from 1948. This one follows that embryonic development story we just talked about. But on the other side, you have the Forster map, which came a bit earlier in 1933. This map isn't based on embryos, it's based on real-world clinical observations, basically tracking how pain from internal problems, like a heart issue, actually shows up on the skin.
And this table really lays out the difference perfectly. Keegan and Garrett's map is pure embryology, but Forster's is all about what doctors actually see in patients. For instance, it maps the upper inner arm to the T1 to T3 nerves, which lines up exactly with that classic referred pain people get in their arm during angina. And because it's so practical, Forster's map is the one you'll see used most often today. In fact, it's the basis for the ASIA scale, which is the gold standard for assessing spinal injuries.
So, how does all this theory and history actually play out in a real-world medical exam? How does a doctor read this invisible map? This quote from the source material really just nails it. The knowledge of this map is what turns a simple touch test into this incredibly powerful diagnostic tool. It's the absolute key to figuring out if a nerve is involved in an injury. So here's how it goes down. A clinician will gently touch the patient, often with cotton wool, to test for light touch sensation. Then they'll use something like a pin to test for pain. The whole time, the patient's eyes are closed, and they just report what they feel. Any area of numbness or weird, altered sensation, that's called paresthesia, can be mapped directly to a specific spinal nerve, which lets them pinpoint the exact location of the damage.
And here is a super fascinating detail. Why do they test both light touch and pain? Well, it's because the nerve fibers for those two sensations actually travel in completely different pathways or tracks inside the spinal cord. So, by testing both, a doctor gets a much more complete picture of what might be damaged. It's really clever.
And in the end, it all comes back to this one number, 31.
That's 31 pairs of spinal nerves, each one with its own matching dermatome, all working together to create this amazing, body-wide diagnostic grid.
So, the big thing to take away from all this is that your skin isn't just some protective wrapper. It's an interface. It's a living, breathing blueprint of your entire central nervous system that carries the story of your body's very first developmental plan.
And that kind of leaves us with one final thought. If your skin holds a detailed map of your spine, it really makes you wonder, doesn't it? What other incredible secrets and hidden connections are just waiting to be discovered inside our own bodies? Thanks for joining me.